So with this, we move to the next part of this panel discussion. So we divided in two parts. This panel discussion for this, let me invite Dr. Manisha Bobade, CEO KJ Somaiya Hospital and Research Center. A huge round of applause for her, please. Let me invite Sir Neelesh Shinde, Group CTO, Jupiter Hospital. Let me invite Viloo Williams, Group CIO, Grant Medical Foundation, Ruby Hall Clinic from Pune. And also, let me invite Bhupesh Arora, Business Head, Digital Energy Division, Schneider Electric, to come on stage. I have been told that Dr. Deepak Patkar, who's from Nanavati Max Super Specialty Hospitals, is stuck in the famous traffic of Mumbai. So he'll be joining us soon. So we welcome all of you for joining us today. Thank you so much for joining us today. Let me start with, the theme of this session is also the same, building resilient and sustainable healthcare infrastructure with Health 4.0. But I hope the questions will be different so that we can have a different take from this set of speakers from the earlier panel. Let me start with Dr. Manisha. She has got huge experience in the healthcare sector. Because since she has got huge experience, I want to ask her about a futuristic question. How are the hospitals looking at next-gen tech innovations to be at the vanguard of their sustainability campaigns? Your thoughts on that?
First of all, thank you for inviting us, and thank you, Goswami, for getting this entire group of expertise under one roof, so that it is going to be a learning lesson for everyone, as well as to express the thoughts. Technology, we are just talking technology. I would like to express my thought about the technology, because my basic qualification, I'm an emergency consultant and intensivist, then turned into the administrator. The technology advanced in such a way, in leaps and bounces, that it is really going to boom in near future across the globe, and so in India as well. I would like to talk about the technology not only in the hospitals, because most of the hospitals are advancing as per their capacities to the highest possible technology to deliver the best quality healthcare services. But India's population majority being into the rural areas, and also a huge gap in a patient and doctor ratio, we need to leverage a lot on the technology if we want to close this gap. And it is very much possible. Government is already initiating a digital ecosystem which they are developing by gathering the patient data, and which will help the healthcare authorities, providers to come together to develop the strategies, to anticipate a lot of illnesses, make the plans, how we can allocate the different resources to meet their demands as well, so that the better outcome can achieve. Most importantly, another thing is that this is just not possible only by the doctors, healthcare providers to take a lead. It is very important that public needs to come forward, and good networking between healthcare provider and community is very, very important. Communities already started getting involved by a lot of technologies, like wearing this lot of wearable devices, which has made it possible to capture a lot of their own parameters data, better accessibility to the healthcare services, early approach, early detection, patient care. That is very much possible because of these wearable devices. I would like to add on one point is, apart from government, there is a huge opportunity for various healthcare providers and corporate group to come forward and to contribute to reach out to the rural areas. And I'm very proud to get associated with the Somaiya group, where we have a center across India at 4 places, where these are the places in the rural areas which are stationed approximately 100-200 kilometers away from Mumbai. And these places scatter the healthcare services across different villages, which takes care of a number of students to get educated at free cost, as well as, most importantly, the healthcare services. We have stationed a lot of technologies which we have used to give the point of care test for all these villages, so that their screening is possible, early detections are possible, because super specialties are not possible to get stationed all the time. And the technologies we get communicated to the telecommunications, by which we can deliver the best healthcare services. So, digital healthcare, yes, a huge thing to contribute, and we can do wonders. India being very compassionate, we will do wonders equally.
Right, right. Thank you, thank you. I'll come back to Dr. Manisha, but very important point you have raised that, which some of the parts we already discussing in the earlier panel also, that how we can transform the healthcare delivery in the rural India or the tier 2, tier 3 cities by the help of technology, and how hospital or healthcare infrastructure can be made and efficient. And obviously, connectivity is a problem, but again, connectivity can be the game changer. We can see it as a challenge or as an opportunity to change the game. Thank you so much. I'll come back to you. Let's have a perspective from Mr. Uh, Neelesh Shinde, Group CTO, Jupiter Hospital. Uh, in earlier panel, Mr. Joy was talking about the net zero thing, the climate change. So energy efficiency is a very important part, Mr. Neelesh. So, how can we implement energy efficient measures to achieve best energy performance index, especially when it comes to hospitals? Because we have to keep in mind the realities of climate change. Your thoughts on that?
So first of all, I would like to thank APAC for giving this opportunity for this event. Moving on, when we say about energy efficient or resilient or sustainable building, with my experience into projects, I believe it starts from the project itself. And when we are talking about connectivity, okay, so project I will divide into three parts, like design and implementation, and after that execution, and third thing is the operations. Okay, so when I'm saying design and planning, now, what is the problem when we say connectivity and design planning? We need to have an end-to-end solution from the energy management software solution, which has to be given by the company to the project side. Because what happens that when we say that architect is there, project management consultancy is there is always a gap. There is no connectivity between them. And what happens, whatever we design on paper, but when we do execution during the project, like in project, if you say that there is a one common word which normally used at least in Bombay is like 19-20. That 19-20 is something like that, whatever has been designed and what has been executed on site is a different. Okay. And then it comes the operational phase. So operational phase is something like that the person who is operating that is not part of that project itself. So he has to work on the whatever as the drawing which has received to him. Now to make that everything has to be connected, it is better to work on the Revit drawings or building energy information system drawing, so that we can able to correlate between all the things from the design up to the operation phase. Now the new software which has come during the construction also, which can give you an idea what is the life cycle cost of the, not here I'm not talking medical equipment, here I'm talking about the equipments what are being used in the maintenance side. Okay, for the building whatever we can get very clearly life cycle cost of that. Now energy modeling softwares are available. Before start of the project only we can able to make out how much energy we are going to save in that project every day. Now when we are talking about all these things, when the project starts, so when we say for the energy measures what we need to take in a hospital, if you see in hospital, if you divide everything, then HVAC plays very, very important role. So it can go between 40 to 50%. 50% is on higher side. When I'm saying that, ideally is between 40 to 43% in a HVAC per day. Now we are talking about medical equipment. So medical equipment, what we are talking CT, MR, Linac, cath lab, everything. The requirement is like 120 kV or 160 kV, huge requirement there. But if you see the whatever they are consuming, maybe not more than 10 to 11% of the entire bill of your electricity. Now, if you consider other than that, what is involved like UPS, what we use other than medical equipment panel, and which can be used for the blood bank or maybe your emergency lighting, the refrigerators, whatever are there, OT, ICU, also contributes more than medical equipment panels. So if you see that, my experience that with my all three hospitals, like 14 to 15% is consumed by that. Now, elevators is only 2 or 3%, STP or ETP is around 4%, CSAT is around 3%, and raw power is around 7 to 8%. When I'm talking about that, So what is important which is contributing is HVAC. So when we are planning something for the net zero carbon, so what is important that for the building point of view, building envelope, if you consider the roof insulation, then the brick walls, what we are going to as the exterior side, and the third one is that glazing. So roof insulation, you know that once you come across, you will come across our terminology like U value, thermal transmitter. So better the lesser the U value, better is the OPEC or that is a good product, what we need to use it for the hospital and to reduce the energy. Now, when we are saying U value or what is thermal transmittance is like whatever the energy which pass, like even if you're having a single or composite material, the whatever the rate of heat transfer between these two material divided by the temperature difference. That is U value, and U value has to be as low as possible. So consider that roof insulation, everyone is having maybe some roof insulation. There are two thoughts, like we should have a overdeck insulation or underdeck insulation. So if you do overdeck insulation means what? Like normally what we do is that on the top of the your floor, rooftop floor, you use normally waterproofing material. If you add some 100 XPS insulation also, your U value will go down drastically. That is very, very important. Rather than doing underdeck insulation, overdeck insulation always will give a better solution. Similarly for glazing, if you are having a glazing, when we are saying that the window and wall ratio should be less than 40%, and when we are saying that glazing, there are two aspects for that. That there are for energy saving purpose, there are glasses which are available where nothing will come inside. But whether doctor or patients will be happy with that scenario? So answer is no, because he is not looking for artificial lighting. He is looking for natural lighting. So you have to figure out between natural lighting, what is the best for the patient. And similarly, now one more important point is that along with that, when we see that medical equipment require humidity less than 60%. And now that is a challenge, how to achieve that in Bombay like city where it goes to 99% RH. We have to bring it down to 60. So a lot of time earlier, they used to use electrical strips and they used to consume more power. So instead of that, if we use either the output of condenser, like the chiller which is there, the condenser output of that can also byproduct we can use to control humidity as a hot water. Or second thing is that which is the best, which been used most of the time, it heat pump. So heat pump will give a very reduced energy, as well as you can able to control its humidity. Now important point, one more thing is that if you see medical equipment, and I work for all three companies, Siemens, GE, so they will always say that the temperature has to maintain between 20 plus minus 2 degree. I don't know from how these figures have come, because if you see that even if you change from 20 to 23 degree also temperature, there's a huge saving is there. Now I understand that during when our patient comfort point, they are looking for 20 plus minus 2, but if you see their original technical data sheet, you will see that all these are operating condition up to 26 degree. Nothing will happen to the machine. Okay, and humidity has to be below 60, and that too also non-condensing. So when I'm saying that, during maybe any machine that may be in use maybe for 14 hours in a day or 15 hours in a day, but 9 hours definitely it will be an idle state. During that period, like even from 22 if you increase, or 20 you can increase to 24 degrees. This can happen in OT also, not in ICU, because ICU always the patients are there. So even if you do in OT also, there's a huge difference. You can just see when we are changing from 4 degree, there's a huge difference is there. Huge saving is going to happen. These are small innovation what we can do, and which can able to do the net zero carbon what we are like. These are small efforts. Maybe I'm not sure that is going to make a huge impact on the HVAC, but yes, it is making for us, at least we are making sure that every day I'm saving around 150 to 200 units. Now, we cannot just say that it will be 1,000 units or 4,000 units in a day. These small contributions are going to make a huge impact. Now, along with that, there is also called as free cooling, because there are certain areas or temperature goes down very drastically. Now we keep that environmental as a atmospheric pressure, temperature we are keeping at 24 degree. So can we use that? If the temperature outside area is around 18 or 17 degree, we can take that as a free cooling and we can use that. So heat recovery, free cooling, these are the things we can always do it to make sure that net zero carbon. And I'm sure that with the new technology and with the end-to-end solution, because that is very, very important, you can able to track that if the things are going out of control. Because now with predictive breakdown analysis also, we can able to achieve good energy efficient hospital. Thank you.
Right. Interesting take. You talked about the gap in the design stage itself, and where there's a gap between design and execution, and how small things can make a difference in terms of energy efficient measures for while building hospitals or upgrading aging hospital buildings to a new one. I'll come to Viloo ma'am, but before that, I think it will be pertinent for me to ask Bhupesh, because Bhupesh is handling this kind of I may say challenges and opportunity as well. You just heard Mr. Neelesh Bhupesh that uh, he talked about certain opportunities and also challenges in terms of energy efficient measures. So can you just shed some light on how some of the tech advancements is making a mark in terms of when we talk about sustainable design of hospital buildings? Your thoughts on that?
So I think in technology, and I heard Neelesh a lot on HVAC. Again, HVAC plays a really important role, primarily to be managed well, and a lot depends upon how we design the infrastructure. Primarily, again, the flow of patients may vary during the day. The utilization of the infrastructure may be varying during the day. We may not be using all these infrastructure where extensive HVAC is being used all through the day 24/7. So we need to have those areas or timings available known either through a mechanism wherein we are able to mechanize our systems that they operate at different times or different temperature zones at that point of time, which is there. So there are sensors which can help detect the number of patients in a room, which adjusts the temperature accordingly. Again, we need not to move manually to 20 to 24. Again, depending upon the count of the patients which are in the room and the ambient temperature which is required to serve them well is really important. Similarly, the facilities, whether it is equipments housed in a room or the patients using OTs or ICUs or different rooms, they can be mechanized completely on the availability. The sensors can detect the presence of because single rooms are very easy to do mechanized, because if you don't have a patient inside, the energy bill should go down, it should go switch off. When a patient is moving from a procedure room back to the room, the technology can switch on the lighting as well as the HVAC before the patient even moves from one floor to another floor, hence saving a lot of energy bill, which is really important. So I think these savings are not only primarily to bring down the energy cost and bills, but again, this money saved is reinvested back in the infrastructure on different things which is there. So there are plenty of ways wherein we can move and reduce these energy bills in an infrastructure like hospital.
Right, right. Let me ask a different question. We heard about the emerging technologies or the next gen technology. We heard about the energy efficiency measures. Let me take a different perspective from the Viloo Williams, who is the Group CIO of Grand Medical Foundation Ruby Hall Clinic from Pune. Ma'am, if I may ask you that, how do you, or you can, if you can give an example, how your organization is implementing or leveraging emerging technologies for enhancing patient care or safeguarding the hospital building, all the overall ecosystem, maybe emerging technology like blockchain, AI, analytics, VR. Your thoughts on that, ma'am?
Good afternoon, everybody. So, and thank you for inviting me today. Before I go into the emerging technologies, I would like everybody's attention to be drawn to one major aspect of digitization in a hospital. That is the patient, what does a patient want? The patient wants service which is extremely efficient. He wants care which is again efficient. I mean, from his own treatment perspective. And he or she really doesn't bother whether you are using the latest MRI for his treatment or whether you are using the best HIS system and so on. So when we are talking about this emerging technologies, what we first see as CIOs or as IT, from information technology perspective, is that do we have that efficiency built into the hospital that gives both the performance as well as the productivity which the patient needs? A very small example: how many of us has really managed to save the waiting time for a patient in the hospital? Today we are struggling at that level. Going ahead, how many doctors are really, we are driving a lot of adoption from an EMR perspective in the hospital, where we want to collect the data that will help us, really take benefit of the emerging technologies. Have we collected that amount of data digitally in the hospitals? I know all my colleagues, all my different hospital friends, everyone talks about digital and everyone has moved far ahead on the digital roadmap, but nobody can really claim that we have reached this stage of digitization which has brought these outcomes. So if I go into blockchain, or if I go into AR/VR, or if I go into AI, I'm personally, in fact, much interested in data science and AI. But have I really brought anything related to that in my own hospital as of today? The answer is no. But AI is not only to be seen from a digital perspective. When we talk about emerging technologies, let's consider the medical side of the technology and keep IT aside for some time. Yes, the best of diagnostics, the best of labs, the best of treatment areas for the patient, where emerging technologies have made a huge impact, is in the diagnostics and the this, where we are looking at emerging technologies from a patient's benefit. There is a lot of things done today in hospitals, even in Ruby Hall, for example, in my own hospital, where there is the latest technology adopted at every stage, irrespective of how expensive it is, how much investment is made into it, because we look at the benefit from the patient's perspective, as the previous panel also discussed. If we could reduce the length of stay for the patient, if we could reduce the treatment time, if we could increase the accuracy and reduce the errors, then that technology adopted makes a lot of difference for the patient, and it brings in a lot of benefits for the hospital. And in such cases, the hospital, I'm sure, is not shying away from investing in those technologies which matter. It also then in turn gives you the benefits of sustainability, because it is helping the patient in at least on the medical side.
Right. I think important part what you have said is that it's not only about embracing technology, but to identify which technology is suitable for my scheme of things. There must be multiple technologies, but I have to identify which technology can be of help for me, and accordingly I can invest on that, which can give results. That is very important. We have come to the end of this panel discussion, but a quick fire round like this, 20 seconds to each of you. Let me start with Dr. Manisha, uh, who is the CEO of KJ Somaiya Hospital Research Center. Uh, uh, if I say that, if I may ask you that, uh, when we talk about the hospitals of future, right? What aspects do you think that India should follow to achieve those goals in like A, B, C? If I may ask you, smart hospitals of future. What are the focus area should be there for you as someone who has been in the healthcare sector for so many years? Quickly, ma'am, 20 seconds to you.
From the advanced technologies which is used for the taking care of a patient healthcare, directly healthcare, most important thing is securing the patient healthcare data. Right now, 60% of our Indian healthcare have become the victims of cybercrime. And we need to secure the data for the patient's identity, for maintaining the confidentiality. Then its use of this healthcare data to be used by the healthcare authorities to make the future plans, which can be planned to make the better healthy India. That is one of the most important thing I feel, which has a huge scope for Indian healthcare to focus on.
Right, right. Thank you so much, sir. Mr. Neelesh Shinde, Group CTO, Jupiter Hospital. Quickly, sir, 20 seconds to you.
So our Prime Minister vision of net zero carbon in 2070. So everyone should think in that way, that energy management solution we need to give it. Like for our own hospital in Pune, we are doing almost 16% energy saving per day, and which has been awarded by Ministry of Power India for that whatever we are doing. And our very clear idea is that the new project which is coming in Dombeli, we are planning for 26% of energy saving per day. So thought process is very clear. Small contribution towards our Prime Minister aim towards net zero carbon. From our side, we are going to do it. And second thing is that when we sing patient centric or everything connectivity, so in that everything patient has to be there as first priority. So that is very, very important. And third thing, that slowly and steadily, whether we like or not, but then we need to move to cloud, because looks like that is the, because every time maintaining everything on our in-house server is going to be challenge. And I believe that future will be cloud for connectivity.
Cloud for connectivity. Nice tagline. Viloo Williams, Group CIO, Grand Medical Foundation, Ruby Hall Clinic. Your thoughts on that, ma'am? Quickly, 20 seconds.
Smart hospitals have always been my favorite topic, actually. And for me, creating a smart hospital starts with better connectivity. Whether it is the connectivity within the hospital or whether it is connectivity remotely across the country, the connectivity is the most important. Second is when we talk about digitization and we are talking about interoperability. This is another area where we need to focus. As Neelesh also said, cloud is going to be the requirement. We cannot sustain on-premise for a very, very long time in terms of cost as well. And cloud will become cheaper and cheaper. So definitely a smart hospital will need to have that kind of interoperability and connectivity to enable those services which are bringing together the rural and the urban areas together, closer together, closing the gaps. And of course, the digital space is moving towards that. Wherever the patient needs to be, the patient should get the service in that space itself, and hence again connectivity plays a very big role in that. So in future, if this is improved, there will be a lot of changes with respect to the making the hospital smarter.
Right. Thank you so much. Bhupesh Arora, Business Head, Digital Energy Division, Schneider Electric. Ma'am talked about smart hospitals. Let me ask you a different thing. 20 seconds to you. We know the smart hospitals or the new greenfield hospitals will be that. What about the aging infrastructure, the so-called unsmart hospitals? How do we make a difference on those kind of infrastructure? Your thoughts on that? 20 seconds.
So, aging infrastructure or existing infrastructure can also be digitized on a very nominal cost. So, we need not to replace everything. We just need to bring connectivity to the non-connected systems and just bringing that data into usable format. And I'll just add to the smart hospital thing also, because cyber secure digitization will help ease of accessibility and availability to more people. So I think that is where it is going to be important. So whether it's an existing infrastructure or new build, we will have to move it to digitized world, which is really important.
Right. Thank you so much. Thank you so much. Huge round of applause for an exciting set of speakers for the panel discussion on building resilient and sustainable healthcare infrastructure with Health 4.0. Let me again thank Dr. Manisha Bobade, Neelesh, Shinde, Viloo Williams, and Mr. Bhupesh Arora. Thank you so much for joining us today. Let me also inform all of you that there will be an award felicitation ceremony right after the next two sessions around 1:45. So I request all the eminent speakers to stay back till that time. Can you have a group photo and then we can move to the next session? I can also request Neha Sharma from APAC News Network to come on stage for the group photo. Join us, please. Can you have the group photo, please?